Today I'm going to give an overview of the principles of separation by DMS, and then examine some of the performance gains that one might expect when coupling DMS to triple stage quadrupole mass spectrometry. And for this talk, it will be all API 6500 plus platform. And I'll illustrate those performance gains using small molecule probes that I've highlighted in this title slide here, since they represent a very significant analytical challenge given recent regulatory initiatives for reduced exposure to these particular tobacco carcinogens. So why, as a CRO developing hundreds of methods a year to support close to 1 million study samples within that same time period, would there be an interest in differential mobility spectrometry? Well, the ability to resolve interference from analyte signal in the gas phase based on differences in an ion's physical cross-section prior to mass spec analysis means that potentially less complex and higher throughput sample preparation and chromatographic separations can occur. And obviously this can save on both labor time and the cost of consumables. Now, the DMS itself is a very cost-effective capital expense when partnered with a TripleQuad, if we compare that against the addition of alternate MS platforms to gain similar improvements in selectivity and sensitivity. The hardware design of the DMS is such that it can be easily installed onto the TripleQuad system for rapid evaluation, with only a few parameters requiring optimization. And so there's a lot of advantages to exploring this technology, particularly in a regulated environment. So to start off, I just wanted to show a few quick slides that demonstrate the advantages of DMS for large molecule. And for this particular challenge, we're looking at Rituximab, which is a monoclonal antibody. And these are the sorts of data we're able to achieve from a very crude pellet digestion when monitoring a light chain surrogate peptide. So on the left here, you can see a blank extract. And here on the right, we have a 20 microgram per mil calibrant, which you can see is challenged by this high baseline noise and isobaric interferences. This is the MRM transition that we're monitoring here. So we're also looking at a charge state difference. So there's two ways that we can get around this. One is to use accurate mass filtering by high resolution MS, in this case, a TripleToss 6600 system, where we plot the exact mass in an extracted ion chromatogram of it using a 25 millidalton mass extraction window. And we can also look at DMS and optimize those parameters when coupled with a 6500 plus TripleQuad. And when we do this, we're able to eliminate enough of those isobaric, or differentiate enough of those isobaric interferences that we're now able to achieve a 4 microgram per mil detection limit. But moreover, if we look at the within batch precision and accuracy between the TripleToss 6600 and the DMS 6500 plus, we see comparable results. So that's very encouraging. Obviously, DMS being the lower cost alternative. So just to quickly summarize this initial slide, this initial data set here, by LC-MRM, this is what our blank extract looked like when we use ion mobility under these conditions, and it'll become clear what each of these parameters represents in the next few slides. You see that we have significantly eliminated all of this chemical noise and or isobaric co-extracted interferences. This allows us to get away with a very crude and rapid pellet digestion approach to sample preparation. And you'll see here on the right, we've been able to lower our LOQ from 20 micrograms per mil, although I wouldn't really classify this as a reproducible LOQ. We've been able to go 5-fold lower and have very good statistics at the LOQ. So again, a very low cost alternative to high resolution that in some instances will allow you to achieve similar results. So with that illustration of ion mobility, improving selectivity by differentiating analyte from noise, allowing us to achieve lower LOQ, let's take a deeper look now at the DMS setup Just to mention again that all of the data I'll be showing today was acquired using the TripleQuad 6500 Plus platform with the latest SelectScion Plus DMS cell design. So as illustrated here, the differential mobility cell interfaces between the ion source out here and the MS sampling orifice. It's in this ceramic housing here. And one can, since ion mobility separation occurs at atmospheric pressure, one can readily add or remove the assembly without having to disrupt the mass spec vacuum. So it's very easy to do a quick and dirty evaluation to see if there's any benefit to using DMS. So the DMS cell itself consists of two parallel planar electrodes, as I've illustrated in this middle diagram here. And there's a heated nitrogen curtain gas flow, which acts as a transport gas, comes in here. And that plays a very, very important role because we can also add volatile organic modifiers to this curtain gas flow to improve separation performance. And we'll discuss the importance of those modifiers and how they align with the characteristics of the applied waveform in the next few slides. And as I've indicated in this middle figure here, a portion of the curtain gas does run countercurrent to the flow of ions that are under the influence of the mass spec vacuum drag. So this not only aids in protecting the DMS electrodes from becoming fouled, but the heated gas at the entrance of the curtain plate provides further desolvation of electrosprayed ion molecule clusters coming from the source. And this is really critical to increase the population of dry ions in the cell that are available to form homogeneous cluster ion populations with added modifier. And just hold that thought for a few slides, as this is a critical aspect of DMS performance. One additional measure that we take in our lab at Altasciences to minimize contamination of the DMS cell is to divert flow when there is no analytical signal to measure. And then I'll just finally mention here the images on the right-hand side of this slide, that in the new DMS cell design, there is a lens at the entrance. So this is without the lens here, and you can see we have two parallel electrodes here, two parallel planar electrodes. This lens assembly, which snaps on the front here, essentially increases the ion velocity into the DMS cell, reducing the transit time through these fringing fields, resulting in roughly a twofold improvement in transmission efficiency. So there are some sensitivity gains when going from the original SelectScion device to the new SelectScion Plus. And then of course, with the sensitivity gains of the 6500 Plus, it really is a marriage made in heaven. So now that we've seen the hardware configuration, let's take a look at the unique characteristics of the applied waveform, the RF waveform, because this is what is used to control the ion trajectory in the DMS cell and ultimately allows us to achieve excellent separation of analyte from interference. So I've just illustrated this in a very simplified ion trajectory simulation where you can see upon application of a separation waveform, ions are radially displaced towards one of the planar electrodes, the extent of which depends on the high and low field mobility. So you'll see this waveform has some unique characteristics. It has both a high field and a low electric field, and the difference in ion mobility between these extremities dictates the effective trajectory. Now, if we superimpose a compensation voltage, a DC compensation voltage, we're able to actually restore the trajectory for a given ion to the central axis of the DMS cell to allow selective transmission through the MS sampling orifice here. Now, in differential mobility spectrometry, you have very rapid transit times through the cell on the order of milliseconds, and that aligns perfectly with the MRM scan times that we typically use for quantitation, where you are anywhere from 10 to 100 milliseconds per MRM transition, depending how many transitions that you have in your assay. So based on the previous trajectory discussion, if an ion had the same mobility in the low and the high electric field, the ion would not drift towards either electrode, right? Because it would remain at the center line and move with the transport gas through the cell. But we know that's not the case, and each ion has a unique trajectory based on a net mobility that's dependent upon the ion's size, shape, and charge state. Now, because each ion has a unique trajectory, it also has a unique compensation voltage. So one of the things that we can do for quantitation is we can link a compensation voltage to a particular MRM transition. So now we have an orthogonal separation approach, one based on the physical chemical properties, that is the molecular cross-section of the ion, and the other based upon mass and its MS-MS dissociative properties. So this slide here really exemplifies the sort of experiment that one might perform to optimize the DMS. So we have an overlaid ionogram at a fixed separation voltage, 3.8 kV. And we define an ionogram simply as a plot of COV as a function of analyte signal. So this plot is useful for optimizing sensitivity and selectivity as a function of the separation voltage, modifier, and the DMS temperature. So here we see a mapping of the optimal COV values for each of the three analytes, which I've colored as blue, red, and green. And higher DC potentials indicate a greater radial displacement of the ion and therefore differential mobility. And that's always what you want to achieve. So one will typically optimize COV at the highest SV possible to ensure greatest differential mobility between your ion of interest and unwanted interferences. So as I alluded to previously, modifiers can be introduced into the gas flow to change how ions interact during the DMS separation. So different ions will have different affinities to form clusters with the modifier. And as a starting point, our lab typically screens several alcohols, methanol, ethanol, to propanol, to butanol, for example, in addition to aprotic solvents such as acetonitrile, acetone, ethyl acetate. Sometimes we'll also use blended solvents. Of course, we are judicious in what we select because it's important that your modifier does not have a higher gas phase proton affinity than the target analyte. You don't want to end up neutralizing your species of interest. So why are we interested in these modifiers, and how are the characteristics of the separation waveform aligned to promote greater differential mobility? Well, when we add a modifier to the DMS cell, we're really changing the collision dynamics of the DMS drastically between a clustered state at low electric field and a declustered state at high electric field, where we have some RF heating which causes declustering. So now we've exacerbated the difference between the two cross sections in a low field versus a high field, and therefore the mobility coefficients differ significantly more. And therefore a greater COV is required to essentially correct the trajectory of that net mobility. So there's some very, very big advantages to these modifiers because they increase not only the DMS resolution, but also the peak capacity. Now, although COVs are not predictable with changes in modifier, they are very reproducible once optimized in the DMS setup. So this means proper thermal equilibration of the DMS cell, since temperature of the transport gas is inversely proportional to the gas density, which thereby affects collisional frequency and therefore mobility. The temperature also impacts the rate and extent of the clustering interactions, which can shift the COV in one direction or the other. So temperature plays a very critical role in a stable DMS system, but it also helps in reducing heterogeneous clusters that originate from the electrospray source, because the goal is to have as many dry ions as possible in the DMS cells so that we can form homogeneous clusters with the modifier of interest. So with that in mind, let's now look at some of the chief applications here. And when we were exploring this technology, we asked ourselves, is ion mobility ready for use in the regulated bioanalytical lab to deliver rugged, accurate, and precise quantitation for those very challenging assays where just raw sensitivity and MSMS does not provide enough selectivity to achieve challenging detection limits for assays, whether that be due to isobaric interference, elevated chemical noise, what have you. So to determine this, we looked at key tobacco biomarkers of exposure to gauge the DMS performance. And we chose these for a few reasons. One is that the tobacco industry is now under the auspices of the FDA, and as such, any new product that is brought to market has to demonstrate reduced harm. And reduced harm means the need to detect key carcinogenic urinary biomarkers at lower concentration levels than currently supported. So that's mainly because the industry is striving to reformulate their products for reduced exposure. The other reason we chose tobacco biomarkers of exposure is that as low molecular weight species, they occupy a large chemical space, and as urinary biomarkers in a rather complex variable matrix, there are additional challenges there in that there is a very high population of biogenic amines. So this means assays need to be extremely selective in order to reduce LOQs, and we'll see evidence for that shortly. Finally, up until recently, tobacco biomarker assays have not needed to meet the requirements of the FDA bioanalytical method validation guidelines, and so many of the methods that have been reported in the literature have not performed these critical analytical evaluations necessary to conform to validation criteria. And these include matrix factors, specificity, linearity, recovery, dilution integrity, freeze-thaw, short-term, long-term matrix stability, auto-sampler stability, etc. I think we're all very familiar with the criteria that need to be met to validate an assay. So I'll start off with NNN, which is an acronym for N-nitroso-nornicotine, since it represents the most challenging analyte of all the biomarkers, and there's only a couple of laboratories in the world that are able to analyze NNN, albeit not at the detection limits with the performance that I will show you today. So NNN and NNAL, which I'll discuss later, are tobacco-specific nitrosamines, and they're formed from tobacco alkaloids during the curing process, and they occur in both tobacco and tobacco smoke. NNAL occurs in tobacco smoke, not NNN. And the TSNA levels really vary widely and are correlated with the amount of nitrate that is actually in the tobacco. And as you'll see in this diagram here for nicotine, which is the precursor to the formation of these class 1 carcinogens, if we demethylate nicotine, followed by nitrisation of the nornicotine, we form NNN. If we just directly nitrosate nicotine, we form NNK, which is rapidly reduced to NNAL. And it's NNAL and NNN that are the urinary biomarkers of interest. And again, this process occurs during the curing process of the tobacco leaves. Now, both NNN and NNAL are eliminated, detoxified by glucuronidation with subsequent excretion in urine. And so existing assays report total concentration following deconjugation with glucuronidase. And we follow the same process. There's an initial deconjugation step prior to analysis. Now, several of the challenges associated with the development of NNN and NNAL are mainly due to the complexity of the extract when concentrated in order to achieve detection limits. So, for example, literature LOQs of 2 picogram and 5 picogram per mil are reported for total NNN and total NNAL. And those can require extract concentration factors anywhere between 60 and 400-fold. in addition to requiring an orthogonal approach to the wet chemistry, that is the sample preparation and the chromatographic approaches. And so when you start to have multiple levels of sample preparation, the recovery decreases. Also, when you concentrate extracts to this level, you also concentrate ion suppressors, and that in turn will challenge your achievable LOQs. The extraction techniques are also very expensive. They're time consuming. It's not unusual, for example, in one report where they take 20 mils of urine, they concentrate it to only 50 microliters following extraction by supported liquid extraction on 17-gram cartridges, followed by 3 liquid-liquid extractions, then a final ion exchange SPE. So as one would expect, the recovery from that process was on the order of 40%. And even after all of that sample preparation, chromatography still required separation on an aqua C18 phase, in addition to a synergy polar reverse phase chromatography. So clearly there's a requirement for improved workflows in order to reduce these detection limits, because many of the baseline smoker urine for total NNN is less than the current detection limits of 2 picogram per mil, so roughly 30%. Now, to achieve detection limits lower than 2 picograms per mil, it's complicated by increased chemical baseline noise, which obviously limits your signal to noise ratio, ion suppression due to extremities and extract concentration, and the presence of co-extracted endogenous interferences. And yes, even after concatenating multiple approaches to sample preparation, because we're in such a low molecular weight category for a biogenic amine, of which urine is full of, there are plenty of endogenous co-extracted interferences. It is very, very difficult to have any sort of selectivity in the sample preparation process. And so we asked ourselves, could we use differential mobility spectrometry to improve selectivity and therefore sensitivity by leveraging a gas phase separation based on the physical cross-section differences between the analyte of interest and the interferences? Now, I think it's important to note that because the DMS cell is downstream of the ion source, it does not alleviate ion suppression that can impact achievable LOQs. But fortunately, with the raw sensitivity of the 6500 plus, that can be leveraged to minimize extract concentration factor, and this will certainly mitigate potential suppression, in turn improving LOQs. So we'll cut straight to the chase, and with the DMS, we were able to drop the existing detection limits of 2 picogram per mil down to 200 femtogram per mil. So we're able to lower it by an order of magnitude. And as I've shown in this chromatogram here, we're able to achieve a signal to noise ratio at that detection limit of 20:1, equating to 15 femtograms on column. Now over here in the sample prep, you'll see significant improvements to what I previously described. Because we only need 1 mil of urine, concentrated only 5-fold versus 60 to 400-fold, it means we can miniaturize the sample preparation process and do everything in the 96 well plate. So that lowers costs and it accelerates throughput. You'll also note that we only need 2 stages of sample preparation, a strong cation exchange SPE and a supported liquid extraction, both of which are extremely rapid processes. We are able to eliminate the need for liquid-liquid extraction, which is a more laborious procedure. By having the additional sensitivity of the 6500 plus, we don't need to concentrate as highly. We're also able to achieve 80% recovery, which is suitable to achieve these detection limits. And again, all of this data was acquired on the 6500 plus system with the SCIEX ion. Separation, we use the Shimadzu Nixera X2. So every separation that I will show you today was done using UPLC. So this is just an example of the assay selectivity. We use non-smoker urine to prepare calibrants, blanks, and QCs. And this is an example of a blank extract demonstrating a null response for NNN at its retention time. And then to compare LC-MRM versus DMS-MRM under optimized conditions, we see a significant reduction in chemical background and the elimination of all of these interferences here. Now, although we have lost raw sensitivity, the fact of the matter is we've lost more chemical background noise than we have absolute analyte signal intensity. And that's all that matters. You see, that's very important here because our MRM transition is a rather non-specific loss of 30 Daltons corresponding to the nitrosyl group. So again, a matrix full of biogenic amines in a very large chemical space at this low molecular weight, which is further complexified due to the deconjugation process. You really need the additional selectivity of the DMS to be able to achieve these detection limits. And you see here the modifier was an alcohol. We used ethanol. The COV was minus 12 volts at a separation potential of 3 kV. So those were the optimal conditions for the DMS. Also take note that if you look at the LCMS profile here, we have peak splitting that almost looks like we have 2 species. In fact, you could almost argue we may have 3 species. And just take a note of that because that is going to become extremely important in the next few slides. In terms of the linearity of response, we're able to quantify from 0.2 to 200 picograms per mil. Again, these are extracted from non-smoker urine with all back calculated accuracies meeting acceptance criteria. And this is just some validation data for between run precision and accuracy derived from 3 batches where we have 6 QCs at each concentration level per batch. And again, all acceptance criteria has been met. Deconjugation efficiency, we want to make sure that we are forming the aglycone quantitatively and that it's able to back calculate against our calibrants. And so we include in each and every batch a pair of high and low QCs that represent what study samples will look like in terms of the ratio of free NNN to its glucuronide. So here they've been fortified in non-smoker urine at the 1-to-1 molar ratio and extracted in triplicate. And again, this tells us that our enzymatic efficiency is good. So one aspect of NNN analysis that has confounded the industry are reports of extremely high levels that cannot be correlated with exposure. And so a number of hypotheses have been proposed for an artifactual formation of NNN, and these include the bulleted points here. Polymorphisms of the CYP2A6 enzyme that can cause variation in urinary excretion rates. There can be bacterial reduction of NNN and oxide in the urinary tract if somebody has a UTI. You can also have nitrosation of nornicotine in urine, so this is an ex vivo conversion. Or if you have high concentrations of myosamine in the diet, it too can be nitrosated to NNN. So these are some of the pathways for formation of artifactual NNN, and the industry is aware of these. But unfortunately, it has an impact because when you start seeing high levels of NNN that cannot be correlated with exposure, one has to question the selectivity of the assay, particularly if none of those artifactual scenarios are present. So we were interested in screening a number of smokers to examine whether or not we would observe these unexplained increases in NNN concentration that might actually be occurring ex vivo, such as the nitrosation of myosamine, or the nornicotine. So we looked at 5 subjects, determined the initial NNN concentration, prior to subjecting the urine samples to one freeze-thaw cycle, followed by 20 hours either at room temperature or 4 degrees C. And as you can see in this compilation here, there are really insignificant differences between the initial NNN concentration and concentrations after the sample stressing. So there's been no adulteration in the analyte concentration. So again, this is using our DMS-MS method. So we thought, what happens if we take the DMS off? We just run this in transparent mode. So that means transparent mode, there is no separation voltage or COV applied to the cell. And when we do that, we notice that for donor 5, when we look at the peak area ratio for the 20 hours at room temperature stability sample, we see a 54% augmentation in response. And for donor number 3, we see a 13% increase in response for NNN. So this is somewhat curious and certainly corroborates some of the reports in the literature. I can tell you that donor number 5 has very limited exposure to any of those artifactual occurrences. And so we thought perhaps this was simply an isobaric interference that was not resolvable under just MS conditions. And sure enough, when we overlay the profiles from subject number 5, we examine MS versus the DMS-MS, you can see that that additional 50% of ion current is explained with this peak here, which has been resolved by ion mobility. I'll just keep that up for a second. So when I showed this slide last year at a couple of the conferences that I presented this at, a number of people have commented that this peak broadening and moderate peak splitting is often observed when NNN concentrations are unexplained, but they go ahead and integrate it anyways. Remember, this is not under the auspices of the FDA. The FDA would clearly question this. So, pardon me. So I think this slide nicely demonstrates the power of having that additional level of very unique orthogonal separation offered by the DMS. And it certainly does cause some concern as to whether or not reported concentrations of NNN in the past have in fact been accurate. These are just some validation results for stability, all acceptance criteria being met. And now let's move on to our next biomarker, NNAL. So as I mentioned previously, NNAL is a biomarker for NNK, but it's also relevant as this biomarker can also be found in non-smokers due to inhalation of secondhand smoke. So for this biomarker, we were able to get away with only requiring 150 microliters of urine when using a single stage of sample preparation, again, because of the additional selectivity offered by the DMS and the sensitivity offered by the 6500 plus. We were actually able to dilute the extracts 1.7-fold. So this is an enormous improvement over existing literature assays. Just make mention here, and I forgot to do that in the previous NNN slide, we are using a proprietary enzyme that allows us to do the deconjugation in only 30 minutes versus the 16 hours that is typically taken. So we have a very high throughput method here. And as you can see, we have plenty of signal to noise ratio here for a 5 picogram per mil detection limit, equating to 50 femtograms on column. In terms of the assay sensitivity gains using the DMS, without DMS, again, we're in the low molecular weight space here. Again, this is a neutral loss of the nitroso functionality. We're going from 210 to 180. We have a signal to noise of about 10 to 1. We're able to improve that 4-fold using DMS. Again, we take about an order of magnitude hit in raw sensitivity here by using the DMS, but we lose a lot more of the chemical noise than we do the analyte signal. So once again, the signal to noise overall improves. So it's very important to have that very sensitive 6500 plus on the back end of the ion mobility cell so that you can afford to throw away a little bit of raw sensitivity, realizing that you're going to diminish your interferences more significantly. Linearity of response from 5 to 1,000 picograms per mil met all acceptance criteria. And once again, validated between run precision and accuracy batch, done in a very similar way to the NNN with 3 batches, 6 QCs per concentration per batch. Again, met all acceptance criteria. This is just as good as your bog standard plasma assay with an SPE where you don't have any interferences and you have high recoveries. We're able to achieve similar results on a very complex assay by using the DMS. Note again, there's both a N-glucuronide and an O-glucuronide, this time for the NNAL due to the hydroxy functionality. And again, this deconjugation efficiency data demonstrates that our enzyme is working optimally, as noted in the accurate back calculations for the total A glycone. And validation results for stability, met all acceptance criteria. So again, if we're looking at harm reduction, it's very important, pardon me, I'm just a little bit out of sync here. It's very important to demonstrate lower detection limits as new products come on the market. So literature reports indicate that total NNAL in about 27% of non-smoker urine samples contain less than 5 picograms per mil. So this, coupled with the harm reduction efforts, indicates detection limits less than 5 pico are going to be required to support the FDA initiatives. So with 40-to-1 signal to noise at 5 picogram, it's really not a stretch to be able to hit 2 picograms per mil with a signal to noise of 12-to-1, equating to only 20 femtograms on column. And when we look at our calibration curve again in non-smoker urine, and we had to screen several donors because even in non-smokers there is NNAL, unfortunately. But we see that we have a 500-fold linear range meeting all acceptance criteria, and precision and accuracy once again meets all acceptance criteria. So we are able to lower the detection limit also for NNAL from 5 pico down to 2 pico with a much more streamlined sample preparation process due to high recovery and selectivity. Now, as I said, the DMS has no impact on ionization suppression, and ionization suppression is a big issue for these analytes despite the exhaustive sample preparation and chromatographic approaches. But as you can see here, because of the sensitivity with the 6500, we don't have to concentrate as much. And because we don't have to concentrate our extracts as much, in worst case scenario, we're seeing 14% ion suppression for the NNAL, for the matrix factor. But when we do the IS normalized matrix factor, it's well within acceptance criteria, and there's really no concerns here of losing the LOQ due to ion suppressors. Again, a significant improvement. In the literature, you'll see anywhere from 30 to 40% of ion suppression, and that compromises your LOQ. So let's look at our last application. We'll finish off with HPMA, which is an acronym for hydroxypropyl mercapturic acid. And 2 and 3 HPMA are urinary biomarkers for acrolein exposure, which is present in cigarette smoke at levels between 60 and 100 milligrams per cigarette. And it's also formed by the heating of glycerin in e-cigarettes, which is then inhaled into the lungs. Acrolein can have a range of adverse effects, including a role in carcinogenicity. Now, the problem with acrolein is that it's found in both tobacco smoke and e-cigarette aerosols. So there's a concern that people who use both e-cigarettes and continue to smoke tobacco products, that is dual users, they're going to be exposed to higher levels than those who smoke only conventional cigarettes. So to help consider the potential for electronic cigarette in harm reduction, we really need data to compare the concentration of toxicants in smokers and conventional cigarettes, users of electronic cigarettes, and so-called dual users. So sensitivity for this particular analyte is not so much an issue, but selectivity certainly is. So we did observe some donor-dependent degradation in urine observed for the 2 and the 3-HPMA when we did our short-term stability assessments, and we were able to come up with a preservative to prevent that. There are endogenous interferences that impact selectivity for 3-HPMA, and there's chemical noise that impacts the achievable signal to noise at the LOQ for 2-HPMA, but again, it's not that critical. There's plenty of sensitivity with the 6500 plus here. And of course, there's a challenge in the chromatographic resolution between these structural isomers. So in terms of, due to the ubiquitous nature, I should mention, of HPMA, we had to use charcoal stripped urine. Because the detection limits aren't that challenging, 2.5 nanogram per mil for the 2-HPMA and 25 nanogram per mil for the 3-HPMA, we're able to get away with only 25 microliters of urine. And in fact, again, because of the high sensitivity of the 6500 plus, we can recon in a very large volume, 400 microliters, after doing strong anion exchange SPE. This allows us to dilute out much of the matrix effect that'll cause ion suppression. We see average recoveries of 83% for the 3-HPMA and a similar recovery for the 2. In terms of sensitivity gains, we don't see much of a sensitivity gain for the 3-HPMA, but hold that thought, because when we get to smoker urine, it turns out there's a interference in some donors. For the 2-HPMA, we are able to achieve improvements in sensitivity in terms of signal to noise by almost threefold, 2.5-fold. So once we examine smoker urine, some donors exhibited an additional interference that could not be resolved chromatographically without prolonged run times, and it turns out the use of much more expensive columns. So what we found with the DMS is that it was very straightforward to eliminate this interference. And I think I'll just comment here that by using the DMS for all of these assays, it gives one a level of assurance that the likelihood of an interference confounding the reported accuracy of the concentrations, is significantly minimized. It's a reassuring peace of mind because, of course, in method development, we can only screen so many donors, but you never know when that one donor is going to come along that might be in a disease state or has a unique diet or a unique metabolism that results in an unpredicted interference. So by using that additional level of orthogonal selectivity offered by the DMS, the likelihood of your developed assay running into troubles during sample analysis is extremely diminished. This is just some validation data for from the between run precision and accuracy for 2-HPMA. All acceptance criteria here has been met, as it has for the 3-HPMA. And this is just simply some stability data for the 2 and 3-HPMA. I'm sure the hardcore mass spectrometrists in the audience are not too concerned about this. So in summary, we've seen that the DMS technology was, or could be, successfully implemented as an orthogonal separation strategy to overcome the significant challenges of each of these 3 tobacco biomarkers, more so for the tobacco-specific nitrosamines. We demonstrated that through the reduction of baseline noise response, we can improve our signal-to-noise ratio and therefore lower our LOQs. We could eliminate co-extracted interferences, and as a result, we could reduce the sample prep and the chromatographic complexity. We were also able to lower the detection limit for NNN by an order of magnitude, which allows us a more accurate assessment of the baseline response in smoker urine, and of course to fall in line with the initiatives of the FDA, putting pressure on the tobacco industry to introduce products of reduced harm. And the only way you're going to know if that product is of reduced harm is if you can measure lower levels than what's currently being reported. And the same follows for NNAL. We've been able to lower that detection limit from 5 picogram per mil to 2 picogram per mil. We've also developed a novel, or found a novel enzyme that allows for rapid deconjugation, increasing the throughput from 16 hours to 30 minutes. And all 3 of these assays have been validated within the FDA 2018 BMV guide framework for small molecules, and therefore are suitable for regulatory submission. I'd like to acknowledge my colleagues in the production of this data, in particular Dr. Mingwan Chen and Lawrence Provenche. Dr. Chen played a large role in the development of the NNN and the NNAL assay, and Lawrence Provenche in the HPMA assay. And of course, my colleague Milton Furtado, who had a large role in contributing to the overall strategy of the approach for tackling these biomarkers. And to Jean-Nicolas Mess, who did much of the work on the Rituximab assay, comparing the DMS to the TripleQuad 6600. And then to the folks in the validation group, from which I borrowed much of that data to demonstrate the acceptance criteria could be met using DMS-MS technology.